experience bloating, pain, and mood swings leading up to their periods. I am included, and we wanted to find out why and what we can do about it. So joining me now, we've got women's health expert Dr. Marjorie Dixon and natural health expert Bryce Wylde. So we have you both together because we should, yeah, sure. I like dealing with it from two different angles because this is the way most of us are living, right? So let's talk about PMS. What is PMS? What is going on?
So PMS literally is premenstrual syndrome. So before you get your period, it's a syndrome.
Okay.
Now, calling it a syndrome means that it has a veritable cornucopia of symptoms. Okay. And I say it that way because so you talk to women, apparently 3/4 of women have had at least one PMS symptom, but it's characterized by emotional changes, physical changes, and sometimes behavioral changes. Like you have behaviors that you wouldn't have at any other point in the month.
Okay.
And so if we divide it up that way, one of the most prevalent ones is irritability. So really, really lovely people can right before their period can become not so nice, but it has to be something that's cyclic and is predictable in its recurrence in that period before your cycle. Irritability can be one of them.
Yeah.
Breast tenderness. Bloating, but really the mood. There's an effect that it has also. The progesterone interacts with how you feel. Your brain has these magical chemicals too called neurotransmitters, and there's something called serotonin, the happy neurotransmitter.
Yeah, we want lots of serotonin.
That's also associated with depression, anxiety. We all talk about that too.
Yeah.
So that's also one of them that's affected. So you have the hormonal bit, you have the neurological bit, and then you have the physical bits. So the receptors through your body have receptors for all of this stuff.
Okay.
And you really do feel different.
Yes.
So those
and
are
you
the
might
symptoms.
have a couple of these symptoms. You might have one. It might be more physical for you. It might be more neuro for you.
Exactly. And so that's the challenge, right? Because it's so variable and subjective, you really want to, if you are having trouble with this, for some people, they get their periods show up and they're like, I didn't really feel too badly. I didn't really have any symptoms. And then other people are like, I wanted to kill everybody around me.
Yeah.
And I felt really bloated. I have pants that I wear before I ovulate and then 2 sets of pants that I wear, which are never white right before your period. And then you get your period and then you go back to your magical happy place.
Yes.
So it really depends on what the individual subjectively experiences, and truly in the medical literature, and you'll attest to this, there's not a lot of consistency in the studies, and people really do debate, is this a real thing? Is this something
It's a real thing.
I know,
It's a real thing. It's not a disease, it's a syndrome,
It's
right?
a syndrome. So if you are going from a natural health perspective, what might you want to use during PMS to help out a bit?
Well, first of all, we treat the whole body. I mean, actually, before, let me preamble. I'm here at the table, in part, not just from what I've learned in the literature and through school. I come from a single-parent family, mother and 2 sisters. I got to know what PMS was growing up, let me tell you. Okay?
Did you hear a little bit about it? Did you feel that?
School of hard knocks, literally. I mean, the irritability factor, that was a part of the Wylde family, let me tell you. So looking at the whole system approach and the whole body, treating the individual and how they, as Dr. Marjorie explained, how they experience that rite of passage, you know, day 21 through to day about 28, depending on the average person. It's a passage. But we do acknowledge and recognize, you know, the symptomatology as well as the general essence of the hormonal imbalance. So we have the go-tos, starting with diet. I mean, this is really where we go, and as Dr. Marjorie will attest to. The focus here, though, and you know I always bring on green leafies to the show, but really what we're looking at here is a complex of intense greens that are high in B vitamins. Okay, B's are key. All right, so we've got beans, and these particular beans here are very high in the B complex. We've got pecans, all right, and the focus being B. B's help to calm the nervous system and equilibrate, as you just heard, that serotonin. In fact, they're the precursor to your body being able to make that serotonin. So it really helps with the irritability component.
So bees will make you happier? Is that what you're saying?
Bees will make you happier.
Bees can help make you happier.
And less variable.
That's right.
And less variable, less mood swingy.
That's right.
Okay.
And so you're looking at here a few foods to avoid. So, you know, coffee, salt, sugar.
Though they make you very happy when you're doing this period.
Right.
They do.
But
It's a
it is a little bit
temporary
of
happiness,
willpower.
I
I didn't
guess.
bring on chocolate here purposely. But
Yeah.
here's what we're not going to stop drinking coffee. Just make sure it's organic and add turmeric. Turmeric is a we've heard about this, the curcumin extract, very anti-inflammatory. So what's happening when you're experiencing that bloating, water retention, breast tenderness? That's inflammation. This is why you reach for the ibuprofen typically, right? Amazing research around exercise, and you don't necessarily feel like you want
and
to.
this is corroborated. Exercise lifestyle change is a big one that will help you through your PMS period.
Absolutely. As you say off camera all the time, Islander first, doctor second,
Jamaican
right?
first, doctor second.
Keep the exercise going, the lifestyle, good diet, nutrition. Great studies recently, in fact, on running 20 to 30 minutes, in particular on those days leading up, if you don't feel, bedridden otherwise.
Okay.
And then we've got a whole slew. I'm sure we don't have time to get through all of these, but let's just talk about the mood and irritability factor. 5-hydroxytryptophan and St. John's wort. What are these in fact doing? Well, they're actually upregulating the feel-good hormone serotonin.
Okay.
Right?
We talked about earlier, the
Yeah.
neurotransmitter, so that deals with that.
And we're talking also, just heed caution, we are still talking about that C to B level science because this stuff is empirically derived, it's traditional, it's not rampant through it, it's not for everybody. So as Dr. Marjorie will attest to, it's a syndrome. This helps some people, not everyone. I'm actually a huge fan of this stuff right here, evening primrose oil. So the gamma-linolenic acid in here is a very potent anti-inflammatory. So it seems to address mental, emotional, and physical aspects of the PMS syndrome.
Now, you're basically trying to do this all the time, though.
Yeah, you're right.
Not when you're just going through PMS.
You're
Like,
right,
you
you're
should
right.
sort of be filling yourself up with the bees.
You hit the nail on the head. So all of the things that you can manage to do to regulate this that you talk about on Cityline all the time will actually help you through that transition. Now, there are times where you do need a physician in traditional medicine. I'm just going to put that in there.
Yeah, can we talk about that? Like, when is too, like, a bad period or a bad PMS too bad?
When
Like,
it's too bad,
you need
because
help.
sometimes you can get depressed.
Right.
You can really get down there. So some people who have baseline depression, who also then have the second half of their cycle, it's a double whammy. They need something that might be medicinal that's going to help them. So you might want to be on what we call a selective serotonin reuptake inhibitor, which keeps the happy hormones around longer, which is what we use to treat anxiety and depression in medicine.
Okay.
Or also, if you want to get rid of the variation of the hormones, you do this baseline. But you might need to shut down those hormones. And how do you do that? Well, you can do that with a birth control pill. You can do that with something that shuts down the communication altogether called Lupron. That puts you into a medical menopause, though, so you have to add back estrogen. So it gets complicated. But in the medical literature, the solution to this, don't kill me for saying it, is take out the ovaries. I'm not suggesting you take out ovaries. Let's just be clear. But you get rid of the hormonal fluctuation that really allows for the exacerbation of all of the physical symptoms that you have. See, he's holding this up.
And this is because Vitex is the natural hormonal regulator in terms of PMS. We've had great success with this in clinical practice as well as in the studies. And I know you're a bit of a fan of the Vitex.
So
as well.
if your symptoms are if they're really bad, you go debilitating. So they're affecting your life. You go to a physician.
Absolutely.
Okay. Thank you. Good advice, guys.
Yeah. Baseline.
Baseline. Do this all the time.
Lifestyle